Kohler.
Thank you, Dr. Huck. It's a pleasure to serve under your chairship. I also thank my former colleague on Merton Council, the Honourable Member for Hastings and Rye, for securing this important debate. As the proud father of 4 daughters, the solitary man in a family of 6, I'm acutely aware of the inequalities between the sexes when it comes to health provision. The evidence is clear. Our health system does not accord women equal priority to men. Their health issues are often ill-researched and underfunded, with women more likely to be misdiagnosed, undertreated for pain, and have their symptoms dismissed. From a lack of research funding into women's specific health conditions, to medical textbooks using many more images of men, women's health is often marginalised. Women regularly report feeling unheard by doctors. Surveys have found over 80% of women report not feeling listened to by a healthcare professional, with their symptoms being dismissed. As one of my constituents recently told me, every woman I know has a story of their pain not being taken seriously. This is simply not acceptable. As time is short, I would like to focus on 2 issues that I know are key to my constituents and my immediate family. In my constituency of Wimbledon, there's a particular concern around the levels and availability of breast cancer screening. Breast cancer is the most common cancer in the UK, with 1 woman diagnosed every 10 minutes. Every year in the UK, this leads to, on average, 11,500 deaths. This is, however, one of the most treatable cancers if caught in its early stages. As I saw with my wife, Samantha, who was diagnosed and successfully treated almost a decade ago, breast cancer is a disease where screening programmes work and are cost-effective. In Merton, however, where most of my constituency lies, there are genuine concerns about the effectiveness of the breast screening programme, with more than 40% of eligible women failing to attend when invited to do so. This is partly due to the fact Merton is one of the only boroughs in London to not have a specific breast screening cancer centre, despite it being recommended by NHS reports a number of times. Now, I acknowledge they are working on this and looking at the potential of using a mobile screening unit in the meantime. However, there is still no firm commitment, and each day's delay means more breast cancer going undiagnosed and women's lives being jeopardised. Finally, as it's Eating Disorders Awareness Week, I would like to focus on how this terrible disease impacts women, as women, particularly young women, are at the highest risk. As my wife and I have seen in our own family, those who take the often difficult step of reaching out for help are too often told nothing can be done. They are not ill enough to be treated, as the resources are not there. With an underlying message, they should starve themselves more, wait until they are thinner. They will not be taken seriously until their condition has deteriorated further. At which point, it is, of course, more dangerous, more damaging, more difficult and more doubtful whether they will ever recover, as eating disorders have the highest mortality rate of any mental illness. I focused in my speech on the 2 aspects of women's health which my family has most experience. In finishing, I want to emphasise the broader point with which I began. We have an unequal healthcare system in which women are treated second best and often marginalised, and that simply must change.
Order, order. Sarah Owen.